Good afternoon. I'd like to welcome everybody to the Poverty and Homelessness Board meeting. Today is February 15th. It's the day after Valentine's Day. So what I'd like to do is go around, welcome everybody, but also then go around the table and have everybody introduce themselves. I'm going to start. I'm Pat Walsh. I'm with Fox Public Relations. And Dan is chewing.
Dan Bryant, First Christian Church in Square One Villages. Steve Bonella, Lane County Health and Human Services.
Good afternoon, Noreen Dunnels with United Way of Lane County.
Rick Kincaid, Community Health Centers, Lane County.
Susan Lopez, representing Victim Services.
John Reich, Oregon Department of Human Services.
Dana Gray, representing Emergency Shelter Services from the Eugene Mission.
Erin Fifield, staff with the City of Springfield.
Paul Solomon, Sponsors Inc. I feel like I should be doing some stand-up with this mic.
Janet Thorne, Education.
Jacob Fox from Homes for Good. Dave Haverland, United States Department of Veterans Affairs.
Pat Farr, I'm the grandfather of Clement Toussaint and Yoali Gomez, and also a Board of County Commissioners member. And Richard, this mic's for you.
Chris McAllister, consumer seat for the PHB.
I'm Alex Dreer from the Human Services Division of Lane County, and I'm the Continuum of Care lead. And I just want to remind everyone, you have to speak very close, direct into the mic.
Well, welcome everyone. Has everyone on the committee here commission had an opportunity to look at the board agenda? And are there any changes or questions before we move into the consent agenda? If not, I'd like to have somebody make a motion to approve the consent agenda.
So moved.
Do we have a second? Second. All right, all in favor to accept the consent agenda signify by saying aye. Aye. Any opposed? All right, well, great. Well, thank you, everybody. Let's move into committee reports. Dr. Kincaid, are you ready to talk about the health care?
I am.
Thank you.
Thank you. I'd like to offer an update for the health work group. Coming around is a memo that will actually request an action by the board related to membership of the work group and expansion of the size of the group. We have met one time, and in our initial meeting did brainstorming activity looking at the intersections between health and issues related to both poverty and homelessness and accessibility to affordable housing. The group is well represented across the vast majority of the healthcare sector. We had participation from the hospital health systems as well as the insurers. So again, a robust discussion. We look forward to additional dialogue in our coming meeting. We did have some gaps, and so in order to fill those gaps, we've asked for additional membership. And we have 3 members that we would like to ask the board's approval. They've submitted the applications, and the applications have been reviewed. We would like to forward their names for acceptance into the work group. Teresa Rourke, Benjamin Brubaker, and Arwin Mas de Spain. Representing, again, Health and Human Services. Also, Ben works with Whitebird and then particularly Cahoots. Arwin is with Occupy Medical. And we feel that those are perspectives that are really necessary in our dialogue. In order to accommodate that group, as well as potential other members, we would like to have raise the cap on the membership of the work group to 15. It's currently capped at 11, and so we'd like to ask for board's approval to expand the membership. Those are the 2 recommendations that we request at this point.
Thank you. Any discussion or comments on what's been proposed? Board members?
I just wanted to, can you guys hear me back there? Oh, yes, ma'am. Yes, ma'am. I just wanted to say that I'm really excited about how the healthcare group is forming and panning out, and that the numbers that we're bringing in represent a wide variety of the safety network that we're trying to establish. And so I'm really excited about these 3 candidates and the group as a whole. So look for us doing a lot.
So with that, I'd like to, if it's all right, we can do that. I'd like to kind of group the 2 of those together in terms of one motion to accept or to vote on. Can I have a motion from perhaps?
So moved.
Second. All in favor to accept the recommendations from the Healthcare Committee?
Who was the second?
Who was it?
Well, I think I was.
You were,
You might
right.
have said it in unison, but thank you.
Thank you. To accept the Healthcare Committee's recommendation and new members, signify by saying aye.
Aye.
Anyone opposed? Great, thanks, good work, thank you very much. Thank you. Next committee report is from the Youth Homelessness Solutions Group. There we are. Hi, Susan. We'll get you.
Thank you. So we've convened 2 meetings since our last PHBA meeting. Pretty exciting. We've got some good momentum going. We've been discussing goals and outcomes that we want for this work group. Additionally, we've also decided to apply for a grant. It's going to be a collaboration between our continuum of care and the City of Eugene. The City of Eugene is going to be helping a lot with the grant writing process. It's going to be a pretty big push and a big lift for us. So we'll be needing an MOU from this board before April, so look for it at our March meeting, if not before. We'll definitely be sending out information as we work on that, but we're really excited about the opportunity this presents for some additional funding to do some of the things that we've already outlined that are much needed in our assessment of current services available and what do we need. So we're very excited.
Any comments or questions for Susan?
My question really is related to 15th night and how closely is Megan or someone, Youth Advisory Council folks? Okay, terrific.
Excuse me. So I know that there's lots of kind of systems assessments and systems inventory work that's happening, and I think it's.
Please use the mic.
Sure. I'm not used to this mic thing. So to repeat myself, there are a lot of systems assessments and kind of inventory efforts that are happening, and I don't think they're well coordinated. And I'm not saying that like in a judgy way. But I know that Peace Health and Kaiser have the U of O doing kind of an assessment. I know that's going to be part of the shelter feasibility. So it's really important for me that they're all coordinated and people know what each other are doing. I don't quite know how to make that happen other than maybe an email with the board members so we can all at least surface the ones that we know that are occurring. So anyway, that's my comment.
Okay. Go ahead, maybe Steve or Alex, maybe you guys can talk about that.
So I want to address that. I know that we, in our office in the Human Services Division, Lisa Stewart is helping with the Community Health Improvement Plan. That's the CHIP. So she's housed within our division. We are coordinating for the Youth Homeless Demonstration Program and the Shelter Feasibility Study. So we do know what's going on, but we can definitely do a better job of communicating that to the Poverty and Homelessness Board and that demonstrating that we are communicating. Thanks, Jacob.
Thanks. Anything else for Susan or any other comments? Okay, great. Those are the only 2 committee reports we had on the official agenda. Is there anybody else who'd like to report out? Go ahead. Okay. There you go.
Just a quick test, 1, 2. Sorry. Just a quick update with League. We are now going to be having our 3rd meeting. We are working on our work plan that should be coming before this group pretty soon. And right now we're in information gathering phase. Fully seated right now for our current capacity, but we're looking into our current group, but we're working on moving things forward and seeing where we're at soon.
Chris, do you want to mention what League is?
Oh, yes. So League is our Lived Experience Advisory Group for Unhoused Engagement. So that's our advisory group of formerly homeless persons to help give their experiences and advice towards the homeless efforts being done on the county level and below.
Commissioner Farr, you had
just really quickly, the Shelter and Supportive Housing Subcommittee, we don't have a report today, but we'll be talking about a lot of the work during the updates to the PHP strategic plan today. So,
thank you. Any comments for Chris or questions for Chris or Commissioner Farr? No. All right. Well, thank you again. I want to thank you all for your good work and for meeting and moving things forward. Now I'd like to ask Jacob to make some special comments about what's happening with the.
Yeah. So I asked just for a brief time on the agenda because, as folks know, today I introduced myself as the executive director from Homes for Good. So we've been going through kind of a transformation of our organization that was formerly called the Housing and Community Services Agency of Lane County. You've all heard me whine about how that does not roll off the tongue. So now we're Homes for Good, and earlier this week we actually put up our new website, and I encourage you all to check that website out. It has an interactive housing search function that allows people to really identify what type of housing works best for them. And it has an inventory and images and information about all of our apartment communities that are all over Lane County, not just in Eugene and Springfield. And the reason why we did it, just so folks know, is that it's not just that our name was hard to say, but there's just a lot of confusion in the community about who we are and what we do. And we used the last year to really engage with the community thoughtfully about our work. And we're the second largest affordable housing organization in the state of Oregon. And we serve at any given moment about 4,600 households or 11,000 people. And we have about the same number of people that are on our waiting list waiting for our housing. So for us, we're really working as an organization to have a bigger impact in the community and to make sure people know about who we are and what we do. So that's pretty much it. I brought some awesome swag, some stickers and buttons, and on the bottom of the buttons is our new website address. So you're going to see a lot more innovation and exciting things from our organization. And just one quick example before I wrap up is we recently hired a woman named Wakan Alferez. She's our new resident services director. So she'll be responsible for all our self-sufficiency programs and also for kind of our case management efforts. We want to house more challenging populations in our portfolio, but we need support from folks around this table and beyond to provide the case management and wraparound services necessary to keep those populations stable. I would give a shout out to Shelter Care and Susan because they're one organization that we have really deep partnerships with, and they are providing those wraparound services. And because of that, we were able to lease up the Madrone grant and house all 33 individuals and families because of their support. Likewise, we have an amazing partnership with sponsors where we're able to house people that are coming out of prison because sponsors is there alongside us providing the case management necessary to keep that population stable. So I appreciate the short time on the agenda, and I'm just thankful for this community and the support that you give us.
Congratulations, Jacob. That's good news. Thank you. We're going to move ahead in the agenda here and have Alex give us a report here on the 2018 point of time count.
Thank you, Chair. I'm Alex Dreer, and I organized the annual point in time homeless street count this year. And in your board packet, we have listed out some of our initial successes this year. There was unprecedented community coordination and collaboration, including volunteer and community engagement. We had over 300 volunteers this year, which is double from last year. So big snaps to that. That includes 167 community volunteers, 97 staff or volunteers from community agencies who are collecting surveys at their agencies through the work they do, which also includes volunteers at nonprofits. We had Lane County staff and 4 members of the Poverty and Homelessness Board. who participated in collecting surveys for us. We had more than 4 TV news segments that discussed the point-in-time count, and more than 2 print articles that came out of our office, and then there were other articles as well in the media that came out about the pit count, so that helped us get so much community engagement. We had 590 views of the online training video. I gave presentations to the University of Oregon students in the 3 p.m. school, the School of Planning, Public Policy, and Management. So we're getting more information about this as a research project as well as a volunteer opportunity to students. We expanded partnerships with Food for Lane County so that all the food pantries that were open during the count time period were collecting pit count surveys, which helps us reach rural areas. And we had a new collaboration with Lane Community College Food Pantry as well. There was active communication and coordination with the City of Eugene Parks Department. So City of Eugene Parks Department had 5 staff who were collecting surveys for us on the day of the count. And thanks to our Poverty and Homelessness Board member, Chris McAllister, we have expanded our partnership with Willamette Lane Parks and Recreation District in Springfield so that they were able to provide us with a list of sites. And I personally saw them progress from being open to providing sites for where people might be camping and where we could count to being actively engaged in the count and collecting surveys themselves. And they're more interested in collaborating on poverty and homelessness issues in the future with us. That's what stems out of the count. So it was a great partnership with a lot of the community. On a logistical standpoint, the surveys this year were numbered so that we ensured that we got every single piece of paper back and that nobody's confidential data is out there in the community that we don't know about. That's very important to us. We also had an app so that there was another way to collect data on your phone if you wanted to use that and not use a paper survey. Thanks to a partnership with Whitebird, we were able to give volunteers flu shots at one of the in-person trainings, so that's really neat. And we got consistent positive feedback from volunteers, and many volunteers said, great, keep me on the list, I want to volunteer in the future and help out. And we got a lot of great feedback about how we can improve in the future. So I just want to thank all of you for assisting us with that, especially helping get out the word so that we could recruit so many volunteers, because we can't do it without the community participation.
Well, very good. I was fortunate I got to speak with a group of up-and-coming leaders that participate in the Eugene, Springfield area Chamber of Commerce leadership group. And one of the things that came across to me was that was a group of people that are looking for ways to engage. And because of Alex's work, I was able to pass out some flyers. And I think it's just really a good reminder for those of us that are involved in this issue that there's a whole lot of other people that want to contribute and find ways to do that. So thank you for providing that. It sounds like the point-in-time count has been successful to date in terms of its organization and how things have happened. So thank you very much. Any questions for Alex about point-in-time count? All right. If not, I'd like, go ahead, Erin.
I was just going to say, when do you think the tally will be?
So the question that I often get is, how many surveys do you have so far, and when will we release the information? Right now we're in the process of data management, deduplicating the information. It takes quite a while, and we hope to have a release of the numbers at the end of April, early May.
Okay. You bet.
I heard there was some drama maybe out on West 11th around the Walmart parking lot from community members, and I don't know if you could give us a little bit of information about that.
Thank you, Jacob Fox. Mr. Fox from the Housing Authority. So the comment is about concerns about people being moved from private property behind Walmart, and we did know that there were some community surveyors who were near Walmart trying to survey individuals experiencing homelessness, and they were actively being moved off of private property, and police were called to assist with that move because people were not happy to move. And so we have identified that in the future we can do a much better job of doing outreach to private property owners about what we're doing and how the pit count helps us address homelessness, so that they're not having to call the police and deal with those issues. And we can also do a better job to coordinate with large businesses and small businesses to let them know that the count is happening and what that entails.
I'd also like to follow up on that in that a lot of people in our community have said that this is an example of the point-in-time count being used to help persecute homeless persons. And I wanted to say that the Eugene police kept their end of their agreement in terms of not sweeping camps right before, in terms of not actually working to remove people on the day of. Now there is this incident in question is an assist call. That means someone else called them to assist. This was not something that was initiated by the Eugene police. Now we have a government that has to be respond when it's called into action, and there's better ways to do things. But I just want to make sure that people know that if you look at the other parts of the blotter, if you look at the days leading to and up, you'll see that Eugene did not actually start sweeps on that portion. If someone calls in on private property, if someone calls in with OSP, if someone calls with Child Protective Services, they have to respond and assist as they're told to. So that's just what I wanted to share on that.
Thank you, Mr. McAllister. And I also want to add the pit count. It is a snapshot of what is going on in our community related to poverty and homelessness, and that it just so happened that this incident took place on the pit count, but it is demonstrative of an issue that occurs in our community. So it's good that we're talking about it because these things happen in our community, whether it's a pit count day or not.
All right, great. Anything else on that? If not, I think what we're going to do is keep Alex up on deck here. No, we're going to do this. So Alex is going to talk about the strategic plan. I am going out of order. I know. We're waiting on some technology.
Okay.
So.
Again, this is Alex Dreer with the Human Services Division, and I have been helping staff the Strategic Planning Committee, the Executive Committee of the Poverty and Homelessness Board, and we have been updating our strategic plan. It is a living document, and so in your board packets, you have a copy of the updated strategic plan, and hopefully some of you have a color copy. It should be color because it's color-coded, but even if it's not in color, you can see the first couple ones through 3.2 are in green. So the board has been updating the strategic plan to make it more specific, in particular updating the Poverty and Homelessness Board Committee that is responsible for overseeing our goal. And then we color-coded it. Green means we are full steam ahead. We have made a lot of progress on that item. Yellow is the next section, and that means it needs a little bit of attention, and that we could advance those a little bit more. And then red means that we really have quite a bit of work to do. And some of those items in red refer to the Healthcare Committee, and it's because the Healthcare Committee is a new committee that has not begun to work on the items yet, but we are hopeful that they're underway. So I'd like to hear anyone's discussion about updating the strategic plan or how we can continue to move forward with our goals. In particular, let's focus on yellows and reds. So that starts towards the end of your page, 1.1C, further. So I'd like to hear anyone's feedback on how we can move some of these items forward.
Oh, Jacob.
Rick Kincaid may know more about this, but I'm on the Peace Health Sacred Heart Community Health Board and on the Community Benefits Subcommittee. And I do know that there's interest from the Peace Health system in increasing their investment around the infirmary beds. So just kind of FYI that Peace Health is really, I think, doubling down in partnership with Kaiser and really delivering for this community in new and deeper ways. And I believe that we'll be able to move the dial on that specific goal because of their support.
Dan.
David, keep the mic. I'm just curious if you have any data from the Veterans Administration on the gap between the number of homeless vets that are still out there, given all of the effort that we provided, 444 veterans housed, do we have a sense of how many more are being added on a regular basis to the number of homeless?
I don't personally, but I think we could obtain some data to attest to it.
Yeah, I'm just wondering, when we say here our goal is 100 additional units, I don't know if that's sufficient, more than enough. Yeah. It'd be good to know that.
I think I'll bring that back to the management team and track it.
If I could add, I guess the one thing I would say about that demographic in particular is, at least with veterans with criminal histories, it is a growing demographic within the correction system. So as it relates to people being released from prison and from the Lane County Jail, we are seeing a growing number of veterans who are disproportionate, well, a larger number of them homeless than housed as they are reentering the community. And that's data I could probably get you from DOC or Lane County.
Yeah, I'll shortstop and mention the work of Lisa Stewart is coordinating most of the numbers down.
Let's address some of the items that are in yellow. Well, first, we'll start with green, all of our successes. They're all written out here, as well as there's an overview page in your packet, because we really have made a lot of headway, in particular on the Housing First MLK 50 unit building. We are currently in the financing phase. We have been awarded 33 units of scattered site permanent supportive housing, and Homes for Good is managing a lot of our projects for Project Operation 600. We have created 120 units of seasonal emergency shelter through Dusk to Dawn. St. Vincent de Paul has acquired a family shelter facility in South Eugene, and we have requested additional funds from the governor to help with operating that family shelter. We currently have created 20 safe parking spaces, so we're 50% to our goal of 40 safe parking spaces for people experiencing homelessness who live in their vehicles. So let's go on down to yellow. 1.1C is develop assertive engagement wraparound services and supports for 150 scattered site and integrated housing first units. So it's been assigned to the healthcare committee as well as the shelter and supportive housing development community in order to identify those units. Lane County has already worked with Trillium to support reimbursement for intensive case management services for Oregon Health Plan members who are living in supportive housing. So it's yellow because we are already working with Trillium to help us have those wraparound services.
So have they committed to paying for that, or is that kind of in negotiations, or how does that work?
For Oregon Health Plan members, I don't know exactly what that process looks like.
We already have agreements around our intensive case management, which is a collaboration between the community health centers of Lane County and Lane County Behavioral Health, and then others like Shelter Care and Laurel Hill Center and others are being reimbursed as well for housing-related work.
Any other questions on the strategic plan?
I just want to comment on the intensive case management piece. Trillium has expanded their intensive case management services and increased their staffing. They're now doing emergency follow-up, which includes outreach component. So much of that work is in progress, and they're continuing to bring on additional case managers, community health workers, and other care coordinators into that function. Again, looking at the high folks that have the highest utilization patterns, targeting that group first, and then sort of working down the list. So that is in progress.
Does anyone have any new information on Occupied Medical's effort to find a permanent home in terms of serving
healthcare needs among the homeless in particular. Nobody does. I just know that's been a huge need, and I get called from them every now and then as they're frantically searching for another place to be.
All right, Chris.
I just want to thank Alex for redoing this update process. While being part of the Strategic Update Committee, it was really nice to see it color-coded and break down what we had. If you look at the original plan approved in 2016, there's a lot of committees that we don't have anymore and we needed to actually showcase that so you guys can see what we're working on. So in regards to a lot of these colors, I wanted to say a lot of the red has been looked at the last executive committee, and we've started to try and look at how we're going to improve those post-haste. So with that in mind, I know that we're working on communication and branding. We're working on collaborations and trying to figure out what gaps we aren't covering with our plans. So as always, I encourage you guys to be part of this process, come to the meetings, give input. Where are we not looking? We can't actually cover it if we don't hear about it. So thank you.
Thank you, Chris. And part of our strategic plan, one item that is red, is to develop a brand and communication plan for the Poverty and Homelessness Board, because we have identified that we have a lot of area for improvement to let the community know exactly what we're doing and how we are coordinating progress on poverty and homelessness issues in our community. And so our chair, Pat Welsh, has agreed to take on the task of helping us communicate better with what we're doing.
Yeah, my business is public relations, which is part of the marketing mix, but I'm going to work with the 2 county staff public information officers to begin to develop brand is kind of a harsh, not really the word, but we're going to develop some key messages and some other things so that people know exactly what we're doing. And of course, once you do that, the job's never done. You've got to continuously repeat who you are and what you're about and how you're doing it and who you're doing it with and why you're doing it. So I haven't had a chance to talk with Amber or Jason yet, but I will, and we'll get together in a meeting and hopefully sometime soon here have at least a preliminary outline of a plan. So that's where we're at on that. So moving forward, we're waiting on some technology for one presentation, and our other speaker was detained and is on his way here. So I would be glad to do a dance that would describe everything that's transpired so far, but I don't think that would be probably a good thing to do right now. So anyway, we're at that point in the meeting. Go ahead. Any other open discussion we could have?
Hey,
Pat, public comment.
More detailed answer to Dan's earlier question.
Pardon me?
Number of veterans still awaiting homes.
Yes.
If you have a moment for that, we have 201 veterans currently on the by name active list.
How many?
201 on the by name active list, right? And then there are 50 unscreened homeless veterans who are on that list. Now that list is incomplete. That's just what the ones that are on the by name active list in HMIS. So as far as how many are out there that aren't identified, I'd say anybody's guess, but it probably is. But 201 is the number that we're actually, if you look in Lisa's the coordinated entry wait list publication.
So I think what we'll do right now is move to the public comment part of our meeting, which is usually at the end. But we're gonna move that into this section today until we're able to get to our speakers. So there have been 2 people who've signed up to speak. If you'd like to come to the table and talk, you get 3 minutes. Marie Wilson. Yeah.
My name's Marie Wilson. You guys have probably seen me sitting in the back of these meetings for about 7 months. And I've been to Springfield Shelter Rights Alliance. I go to a lot of different things and I listen a lot. I listen to the county commissioner meetings. I've been to the meetings where they tried to provide support for car camping. And when I first heard about car camping, I'm like, you've got to be kidding. Who wants to live in a Camry? But after watching what's been going on, I'm volunteer at Egan. I pick up trash in the park with homeless people. Living in a car is a good thing. So you guys expanded the car camping. I remember asking Mr. Bozovich at the meeting, okay, if you guys vote on the 27th, can we get people in there on the 28th? No, he said, that's going to take a little more time. So my understanding right now is even with the expanded car camping that happened and the approval of money and a lot of discussion, and I believe that vote took place on November 28th. My understanding right now is there may not be a single new car camper in that Santa Clara area. Let me tell you what I know. In November, I got a bonus where I work. We bought the book from Community Supported Shelters. We built a Conestoga hut, my family, in my garage. Through a lot of work, a lot of phone calls, we got it placed, and the person who's living in it's been there almost a month. So my question is, where's the clog? What can we do to help Keith? What can we do? And I'm just a person that has 3 jobs, but I'm willing to make phone calls. I'm willing to go out and talk to people. I'm willing to do pretty much anything. I come to some more meetings. I love these meetings. But we've got to find a way to move the progress of that because a lot of people think it's already happened. I talk to people all the time that say, oh yeah, they added all those car camping spots. And when I ask Chris, I'm like, how many have we got? I don't think we have any. I just asked Heather. She said, I don't think we have any. So tell us what to do. I think we can get some people together, phone calls, in-person visits. I will tell you that Lutz Bennis at St. Vincent, or at Seventh-day Adventist, where we put our hut, is totally in support of this. We've had a really good result with the hut that our family built. So let's find a way to get some people out there and out of having to move their cars every day. It's still a Camry, but it's a start. Thanks.
Thank you very much. Very important. The comments about Marie's? Thank you, Marie. Chris.
I'm going to be meeting with Keith Heath on Monday to find out what's currently going on with the car camping expansion, as well as a couple of the other car issues like the towing. So as soon as I find out, I will send some information, and hopefully we'll get it out on the mailing list or through our next meeting. We can talk about it. So there will be updates, at least from some of us, when we find out. But thank you for the question.
I would just add, we actually do have a couple in the Santa Clara neighborhood, but they were put up before the county, and it was just quietly done. But the Autobahn is actually on county property, and I've spoken with the owner, and he's actually thinking about adding a third to his site. I've actually spoken with the Assistance League right behind there, and they were going to, and then the national organization, evidently, from what I got, said no go. And so that's the challenge that I find, because I have a lot of conversations with people. The insurance issue is a huge problem. And I counsel churches that it is part of your mission as a church, and therefore it's covered under your standard liability policy. I don't know that you can make that argument to a business, but you certainly can for churches. So the clog specifically is figuring out a way to provide that kind of liability insurance would free it up for a lot of folks. So
if they charge a $5 fee, if the website charges a $5 fee, St. Vincent de Paul's liability can't cover it. Just got to work around it.
Interesting. That's the first I heard of that. I'll have to explore that some more.
Great. Next is Pat Allen.
Hello there. I'm Pat Allen. I'm on the Lane County Public Health Advisory Committee, and I'd like to alert you to an upcoming community forum. And on the back table there are signs describing it. It's on health. This is somewhat related to your activity. It's on health equity or not in Lane County. It will be a meeting at Lane Community College, and it will start with a couple of speakers and then break into table discussions on the topics. And dinner will be included, but you need to register ahead of time because LCC doesn't like to be surprised at providing at the number of dinners they provide. So again, this is in response to the Board of Health that wished us to take on the topic on this topic. Thank you.
Great. Thank you very much. Any comments from the group?
I just have a comment. I think that's part of the Equity Coalition work, and I think it's March 8th we're talking about?
Yes,
the
March 8th.
So maybe we could send out via Diana the link to that instead of the, because sometimes it's hard for people to manage the paper. But those coalition meetings, those quarterly coalition meetings have been fabulously attended, and it's some of the best discussion around equity I've seen in a number of years. So maybe if we can get that link out, that would be wonderful.
As an addition, this is a coordinated effort of Lane County Access and Equity Board, Lane County Public Health, and the equity portion of the CHIP,
right?
Lane County CHIP, and sponsored by United Health and or by United Way, Trillium and others. Thank you.
Thank you very much. Great. Anybody else? We only had 2 people sign up to make public comments. Is anybody else would like to come up and speak for 3 minutes?
My name is Todd Boyle. I live out in Amazon neighborhood. Regarding the strategic plan, it would be useful for a lot of people's, understanding if it had a cost figure, especially cost per room or cost per unit. And of course, that's very costly to produce. Probably talking about staff positions for so many different diverse places. And also, the cost information wouldn't be useful unless it included other information like what kind of services were bundled with the units, and what are the other features of the unit that make it more or less costly. But it's almost universal in the community discussions that someone will pop off, oh, they spent $250,000 per unit, oh, I could do it for $150,000, or give me $20,000, I can do it. So I think it is an important element of both PR and also management of the resources. Thank you.
Great, thanks, Todd. All right, Dick.
I just think it's great that we have a mic. I think it's great that we have a mic, and I think that it might be useful if we can help people understand how best to use it. Because if you don't use it properly, people can't hear. So maybe you could give us a demonstration on how to use the mic.
Thanks, Dick.
Hold it close to your mouth is number 1. It should only be about an inch away. Yeah.
Thank you. Somebody else has their hand up? All right, if not, I'm going to close the... Go ahead, Chris.
Todd, if you'd like to know more about, at least with one of the projects mentioned in the strategic plan, Jacob's team put together a nice handout on the 50 unit that has breakdowns, it has structure plans or concepts, and it has an idea about why we charge certain things or why certain things are done. I also know that people who are attached to that project, if you look on the list and see who's affiliated with it, they have a lot more intimate knowledge on that. And part of us doing rebranding and putting out some of this information is putting it in a form so that people can look at it and use it, as opposed to looking at this long chart of numbers and going, what's all this mean? Because we use a lot of acronyms in what we do. Thanks.
All right. Anything else? Yeah. Okay, hi, Wayne. Here. Speak right into the microphone.
Something I've done rarely. I just wanted to follow up some remarks I made about 3 months ago. I was mentioning then that a group of people who have called themselves Ward 9, thanks for nodding your heads, is still meeting on a weekly basis. It's composed, the steering committee is composed of about 7 who are unhoused and about 5 who are housed. And just wanted to let you know that they wanted to see what they could do. I mentioned this before. See what they could do about helping people in the middle of cold nights. Those nights where the warming center may not be open, or in some cases, even when it is. And so we have a large 12 by 26 tent. For a while we were putting it up wherever we thought the need was. And then we began to encounter inquiries by the police. And so we are now located in a fairly permanent location at 754 Washington Street. So on extremely cold days, we open up our arms and our tents and our food and our drink and try to keep. That's actually in the backyard of a new property that has recently been bought by the Catholic Worker of Eugene. Catholic Worker of Eugene. It's Franciscan based, and you may know who Brother Charles is. And so some of us on Charles's board have assisted to purchase a house for about $525,000. In the backyard, it's a safe place to pitch a tent, 26 by 12, and try to come to the assistance of people who need to get in out of the cold. Thanks for listening.
Thanks, Mike.
It's good to have that update.
Any comments? Thank you, sir.
So along those lines, I represent the Eugene Mission, and we have cold weather policy where we can accept folks that normally wouldn't be able to come into the mission under our normal guidelines on special cold nights, and typically we're about 2 degrees above the Egan Warming Center. So they may not be open, but we may have cold weather, so you can always call and check in at the Eugene Mission. We always call that about 4 p.m. when we know what the weather's going to be that night. So.
Great, thanks, Dana.
Is that on social media or any other way, or is it a call only?
Typically it's call only.
Okay, thank you.
Well, great. If there are no other comments, I'm going to close the public comment part of our meeting, and I'm going to turn this over to Dr. Lutke, our Public Health Officer. Thank you.
Good, thank you. So I was asked to speak about hepatitis A prevention, and I think probably most of you know that we are sadly in this country experiencing some pretty significant outbreaks of hepatitis A. It really began about a year ago at this time in San Diego. They had a smattering of cases, 2, 3, 4, then a week went by, a couple more. And it wasn't too long before they started seeing 10 a week, and then 15 a week, and then 20 a week. All told, they've had 600 cases. They've had 20 deaths. And it really alerted the country to the potential risk. And of the persons who were in that outbreak of nearly 600, about 75% were people who were struggling with homelessness issues. And that put it on the radar screen of a lot of other communities in our country, as you might well imagine. And I'm going to kind of pick up the story from there. I kind of have 2 parts. I have a pretty data-centric part, what's happening nationally, what's happening in the state, what's happening in Lane County, and then a sort of way forward policy and prevention initiative way of what we've been doing at Lane County Public Health. So I'll talk briefly about the recent epidemiology. You can see my first bullet up here. A little bit more about San Diego and a few of the other cities. A bit about trends in Oregon. Thankfully, we don't have a lot of hepatitis A, but we'll see that data shortly. And then finally, what it is we are doing and what we plan to do to help our communities prepare if hepatitis A shows up here in large numbers. So we have a vaccine for hepatitis A. Just a dozen years ago, we mandated it for kids in 2006, and it's a great vaccine. We would love to have a vaccine for influenza as good as this one. You get it once and you're done. But influenza is a different issue, mutates every year. You got to get your vaccine every year. But Hep A is a great vaccine. 95+% of people who get the vaccine are immune, and we love it. It's a 2-dose series. If you only end up getting one because your life is chaotic, you still get 90% protection with just one. So it's a wonderful thing. Because of that vaccine, you can see the trend, even those of you in the back row, you can see that the number of cases over the last roughly decade have been decreasing in this country significantly since we introduced that vaccine. You can also see that the 2 biggest groups here are really the 20 to 29, which is the yellow line, and the green line is the 30 to 39. That's the largest group of hepatitis A cases in our country. But every population decile, every 10-year population has some cases. Hepatitis A can infect every one of us. So if you look at hospitalizations, many people think that Hep A, oh, you might turn yellow, but within a few weeks you get better. But you can get pretty sick with Hep A. And the sickness and the hospitalization rates have been increasing over time. So if you take a look over the last, handful of years here, you can see that back in 2009, 39% of people were hospitalized, slowly increased. In 2015, the last year we have good, robust data from our hospital system, nearly half of people were hospitalized. Hospitalizations, they change people's lives. You may miss work, miss school, can't take care of your kids. It's a problem, and we really pay attention to that. So hepatitis A is not benign. It's not a couple days of sickness and you're back at it full strength. There are a number of ongoing outbreaks. I mentioned San Diego. They have 577 confirmed cases again. They had 20 deaths. It didn't take very long before it spread upstate into Santa Cruz. And I'm going to talk briefly about in a moment about Santa Cruz and what happened at their jail. And you can see some other outbreaks that have been announced. And as of just a couple days ago, there's a new one in Monterey, in California as well. They have a couple dozen cases linked to San Diego. So one of the concerns I have as your public health officer is there is a lot of commerce up and down the I-5 corridor. I go to tent camps pretty regularly. I don't think there's a time I go there where I don't hear that somebody came up from Southern California, from the Bay Area. There's a lot of commerce, so we are potentially at risk. This is a communicable condition that through dirty water, dirty food, contaminated water and food that we can spread. The main risk factors vary a little bit by outbreak. I said that most of them were homeless and/or illicit drug users, typically injection, but not always. And that's true across most of the outbreaks, around 3/4 or so. But we also have people living in poor environments in terms of hygiene. So fecally contaminated environments, poor hygienic conditions. And I suspect several of you saw one of the initiatives that San Diego did, which surprised a lot of people. Because the homeless can often live in a really challenging area, and because it was spreading in this population, one of the ways to kill this virus is to bleach all of the areas where they live. So they went out and hired power washer firms, and if you saw it on the news, they were going all around San Diego power washing sidewalks. It was really quite visually surprising to see that happen in the 21st century. So San Diego, I mentioned their outbreak. About 5% of those patients also had hepatitis B. So it's a double hit to your liver. That might be part of the reason people were hospitalized at a higher rate. An even higher percentage had hepatitis C virus. Median age, you can see, of the persons in the San Diego outbreak. And this is Michigan, Utah, and this is Santa Cruz. We don't have all the data for Santa Cruz yet, but part of the reason this has been a pretty severe condition is because there's a lot of other hepatitis out there, which is kind of sad. We don't have a vaccine for Hep C yet. Hopefully one day we will, but we do for Hep B. Now let's go from national down to Oregon. We don't get a lot of Hep A, as I alluded to early on. This is the last handful of years, and the 5-year average here is the last one on the right. A couple dozen cases at most in our state. Now, the savvy amongst you will say, well, how good is our surveillance system? It certainly isn't perfect. Adults who get hepatitis A often get pretty sick, and the older you are, usually the sicker you get. But kids can run around with it and still play all day long and have Hep A. So we probably miss a good deal of 2, 3, 4, 5-year-olds who might have mild hepatitis A. So our surveillance system isn't perfect, but we don't have a lot of Hep A in adults in this state, and that's a good thing. The main risk factors for the 23 cases we did see last year, 40% were travelers to foreign countries. Spring break is coming up. I'm about ready to put out a public health notice to colleges and universities that if you're going overseas, please get your Hep A vaccine, and I say the same to you, please get it. Of course, many of our persons at risk for this particular outbreak who are homeless probably aren't traveling overseas, but that's a big risk. A lot of countries are not quite as clean as ours. A couple of the visitors, were visitors to San Diego who went to certain restaurants. We had 5 persons who were in the MSM category in public health. That's men who have sex with men. And that's a big category in Europe right now of spreading hepatitis A in the men who have sex with men population. So it's not a high-level disease in Oregon. Now, I'll talk briefly about the vaccination and vaccine recommendations. In our country, we have a committee, part of the Center for Disease Control. It's called the Advisory Committee on Immunization Practices, ACIP. They make recommendations for all vaccines. These are their recommendations for use of this vaccine. Now, San Diego has decided that they've found an individual risk factor. This is not in the ACIP recommendation for the homeless. They have gone out and vaccinated thousands of people. We might very well do the same here if we had enough vaccine. And there's 2 parts to that, and again, I'll get to that in a minute. The other possible high-risk persons include, if you think about systems and processes, well, what about the ambulance system? They may encounter people with hepatitis A. We currently don't recommend they get Hep A vaccine. Same with food handlers. 20 years ago, all food handlers in America got hepatitis A vaccine. The risk is very low in food handlers, so we don't recommend it now. San Diego identified some links to food services, and they went ahead and mandated vaccination for Hep A for food handlers in their community. So that might be something we do if we have a terrible outbreak. I don't expect we'll have one, but I want to be prepared for it. There have also been, sadly, for many medications and many vaccines in this country, routine shortages which drive us crazy. One of the vaccines is now in shortage. We're hoping that the production will increase in March. That's what we've been promised, but we'll see. I alluded to supply. The big one is, there are two big manufacturers, Merck and GlaxoSmithKline. Right now, only GlaxoSmithKline is shipping. Hopefully we'll get some more from Merck. So what has the Oregon Health Authority done at the state level? They purchased a good deal of vaccine, 1,700 doses. They have some in reserve if we do have a big outbreak, and if it happens in Lane County, we'll have access to those 600 doses of vaccine. But it might happen anywhere else, who knows? It might happen in Medford or Portland, then they'll have access to it. We are one of the identified high-risk counties according to the Oregon Health Authority. Even though we only had 23 cases in the whole state last year, we had a higher percentage per population than some other counties, so we're at higher risk. So we provide data to them, Oregon Health Authority, so they can collate the data. I'll leave these slides with you, and you can click on some of these links for some more data. I put them in there if you're interested, but we don't have time to go over all of it. But needless to say, there's a lot more that you can find if you pursue it through this presentation. I'm going to skip this because we started late, and I need to get to Peace Health shortly. So if you have further questions, comments on any of this section, here's my contact information. And then for the Oregon Health Authority, there's several names and contact information as well in particular areas. So I don't know all of the positions. I know some of you. It's nice to see familiar faces, but I know some of you are dealing with preparedness, some of you are dealing on the medical side, etc. And you can plug in with some of these people. They are all well alerted that I'm sharing their contact information, so please take advantage of it if it's of help to you. So what are we doing locally? Anytime we have a public health issue, we typically try to leverage all of our existing relationships. I've put this in 4 main areas. The clinical community, some of you are in the clinical community, you get HAN alerts, Health Alert Network. We send out HANs routinely to the clinical community for diseases of interest. We have sent out a HAN on the hepatitis A issue, and we probably will send out some more as the data warrants. I'll talk briefly about the media. We do a lot of interaction with safety net communities. I mentioned already, I go out to the tent camps. I've been over at Dana's shop many times, and Jack Tripp's shop at the Eugene Mission, etc. And we work very hard with them. And then we do a lot of specific outreach to high-risk communities. And for Hep A, these are the big 3 high-risk communities. Probably not so much MSM in our country, but it may be our surveillance system hasn't picked it up as well as we wish it would. So I'll take these one by one, and then I will finish. First, the clinical community. We've really tried to raise outbreak awareness. So I mentioned a HAN, the Health Alert Network. We sent out a HAN to the community. I have an email called Just the Facts. That's the JTF up here. And I send that out kind of below the level of an alert just to let people know, hey, there's hepatitis in San Diego. We're not scared here, but you should know about it. That sort of thing. There are other counties, Multnomah County in particular had a huge hepatitis A virus summit with their clinical community about 2 months ago. We're all trying to learn from each other, the 34 health departments we have here in Oregon. So we're doing a good deal in that arena. We're trying to identify or help the clinical community identify the high-risk persons, again through some of that messaging, but also through direct conversations. We're looking at how we're going to promote the vaccination to those 3 highest risk groups. There are some toolkits put out there. Michigan put out a good one for the media and also a good one for providers. We're working on that. We haven't done that yet in our health department. And one thing we're trying to do, and I would ask each of you to consider this too, hepatitis A has a long incubation period. This is not like the flu, where if I had swine flu and I coughed on you, in 48 hours you'd be sick. Hepatitis A can be weeks. So it can smolder, and a case here and a case there, and then all of a sudden there's 50. And in those 50 cases, contact 50 others, and it smolders and smolders and smolders, and then there's another 50. So we need surveillance very quickly. So if you see a person who is yellow, we want to be called, we want to know about it. We want to investigate it very quickly, get our vaccine, and vaccinate everybody around who may have contacted that person who had hepatitis. So please, if you are in the clinical arena or in the arena where you may see somebody that way, either plug them into healthcare or let public health know. And that will help us pick up on this earlier and perhaps not have 577 cases like San Diego. So for the media, we have a public information officer at the health department, and we have done a great deal with the media. I hope you've seen some of our spots. We've had several spots with the print media and TV and radio. I mentioned the media toolkit. Michigan has one, San Diego too. We've stolen liberally from the health officer in San Diego. Her name is Wilma Wooten, Dr. Wooten, she's wonderful. And we're really trying to promote 3 key practices here. Number 1, get vaccinated. We have a great vaccine. It's a little bit in shortage now, but there's enough for our purposes. Number 2, work on good hygiene, see what we can do about promoting that. And number 3, report symptoms early. We want to pick up on this early. Next is the safety net facilities. I've reached out to several. I guess I'll go to the Eugene Mission. I called Jack Tripp pretty quickly. I think it was last September, October when San Diego announced their emergency. And others. We've worked with the jail. We've worked with many other sites. So we're hoping to continue that as the data promotes us to do so. We've worked with the needle exchange and the particular risk populations. And I told you I was going to talk briefly about the jail. When the outbreak spread from San Diego up to Santa Cruz, they had 4 cases in inmates. And it turns out that the vendor that won the contract to run the medical department at the jail in Santa Cruz also won the contract to run our jail here in Eugene. So I know their vice president. I talked with her regularly. I called her up and said, hey, you know, what are you doing? She said, oh, don't worry. The health department in Santa Cruz took care of everything. They swooped in. They vaccinated everybody. They gave all sorts of lectures. I had to tell her, that's not going to happen in Lane County. We have 4 nurses for a county of almost 400,000 people. We do not have the resources to swoop in and do this. We don't have the vaccine. That's not going to happen. So how can we work together better? So these conversations really put you on the right footing and help you have a better understanding of how you can address these things with the resources that you have. So last is getting info out to high-risk persons. Counting on you for some of this again, and I've said several pieces already, but I want to make sure that I leave you with the call us early if you have any concern. Report anybody who has symptoms akin to what you see here on the bottom in this graphic, stolen from San Diego. Hepatitis is, you know, it's kind of an interesting infection. You don't always have right upper quadrant, which is where your liver lives, right upper quadrant pain. You don't always turn yellow. Sometimes just the whites of your eyes turn yellowish and your skin doesn't. It's hard to see yellow if somebody is African American. You can't see jaundice in people with dark skin. So there are other symptoms. You just don't feel well. You're under the weather. So if you start to see that and you don't think it's influenza, this time of year that's kind of hard, please report that. So I will stop right there and take any questions if there's time.
Thank you, Doctor, for that presentation. Just a couple quick questions. A lot of our homeless populations are experiencing a lot of these symptoms standalone already due to the nature of their living, the food, and where they slept last night. Other than the jaundice, none of it really stands out. Also, I can't remember from your slide on the actual homeless, did it say there were 0 cases among the homeless at the bottom of your slide in Lane County when you're looking at the stats regarding us? So if our homeless populations aren't currently being counted now and they're not really getting access to health care as we would want them, where would we send them? Who would we report them to that they'd actually get this options from a limited vaccine pool? Sorry for that big one.
That's fine. So there's a lot of safety net clinics. I suspect amongst everybody in this room, we probably know every safety net clinic in our county. And those clinics are open. Does that mean that the patients can get there, that they can navigate the system? We all know that that's a challenge. So all I would say is be persistent and get them into Volunteers in Medicine or Whitebird or the community health centers of Lane County or Occupy Medical. And you're right about these symptoms being a little bit nonspecific. That's a sad fact of this virus. And these can overlap with certain other symptoms. So people with tuberculosis, they don't come to you and say, I think I have tuberculosis. They come here with a wasting disease. I don't feel well. And a lot of it looks like that. So we just have to be persistent. I wish I had a better answer for you.
Pat, could you comment on other sites where potentially high-risk people are engaged, methadone treatment centers or other places, HIV Alliance, et cetera, that, and how effective we have been in vaccinating at those connection points?
So, you know, every coin has two sides. We have 4 nurses, but we don't have 40 nurses. So when you look at where, what you're able to do, what you could do, what you should do, you try to focus on high-risk groups, and I think that's what Dr. Kincaid is alluding to. So when we first heard about this, when San Diego gave their declaration of emergency in September of last year, my first thought was Eugene Mission and the jail. And my second thought was, how do I get to all of the freestanding tent camps, et cetera, that I'm aware of, that I pretty frequently go to anyway. So we kind of went in that order. Then after we did a little bit of that work over the course of a couple months, then we looked at other entities. So the HIV Alliance is clearly one. You know, they deal a lot with injection drug use. They have a couple needle exchange sites, one in Eugene and one in Springfield, each week. So we work with them as well. But again, you know, we don't have unlimited bandwidth. So we have myself and 4 nurses, and if this was the only thing we did, that'd be great. But this time of year, we have immunization exclusion for all of our schools, so we're giving, you know, thousands of immunizations, and there's always STDs, there's always tuberculosis cases. So we prioritize, do what we can, and rely on you to be part of our surveillance network out there in the community, and we can't do it without you.
Speaking of schools, what kind of communication are you doing to the schools so that our homeless communication that is within the schools? I mean, we have, last year Eugene had over 900 students that were homeless, Bethel and Springfield in the 400 range, 500 range. So what about all of that cross over and families that are visiting some of those places and then bringing it to the schools, and those kids that you said can go on forever before we recognize it?
So we have not gone directly to the schools yet. They're on our list, however, I can tell you that. Part of the reason is it's now a mandatory vaccine since 2006 in this country, and we're really good at getting the vaccine to kids, and that's partly why the numbers are dropping. And that might also, just to give you a little bit of illusion here, that might also be why there are sicker people, because when we had 1,000 people and a lot of them were kids, well, not as many people got hospitalized. Now all the kids are getting immune, the people who are sick are getting really sick. So I think that's a good point, and I will have to chew on that a little more because we haven't gone out to the school systems yet. So thank you for the nudge.
All right. Thank you, Dr. Lidke. We appreciate you being here, and thank you for your patience with our technology, and we're glad you were here. Thanks, everybody. I'm going to turn things over now to Paul Neville, who's going to talk with us about Youth House and Family Shelter. Thanks, Paul.
So I'll try to keep this quick because I know we're running a little long. What time?
1:30.
Okay. Well, I'll try to finish even earlier. So thank you, and I apologize for being late. I was going to use the excuse of working for a nonprofit that has a 5% administrative ratio, so we're always running every way, doing 1,000 different jobs. But I realized everyone in this room almost is in the same position, so it doesn't fly. So we are going to open the St. Vincent de Paul Youth House hopefully by the end of February. Our hope is to have our first 6 residents selected and in the house before the start of March. We will accomplish that, just to give you some nuts and bolts, by putting the notice that we're accepting applications from homeless, unaccompanied teen girls or people who identify as females. We will put that out on the RAND network, which I think most of you are familiar with, through the 15th night. And we will also just make it available to the McKinney-Vento liaisons in each school district, each of the districts, and also on our website. And we will be accepting applications on a first-come, first-served basis. We will be interviewing each applicant. We're waiting until the last about a week before we open. My idea is that it's not a good idea to wait a long time with homeless youth between the time you accept them and the time you get them in the door. So I want to be able to say to them, you're moving in tomorrow, or we're going to have an interview with each kid. We want to make sure that they agree to our program plan, which, by the way, puts primary emphasis on education, completing their high school education. So we're going to try to move quickly, but that's why we haven't You know, we didn't want to get kids signed up 3 weeks, a month in advance. The facility is completed. Those of you who haven't seen it, I invite you to come see it. I'm going to have tours not this Saturday, but next Saturday at 10, 11, and 12 o'clock. And that's 3350 South Willamette, right across from the post office substation. It's been a long haul, but it's a beautiful facility. And those of you who've been in it, I almost feel badly because it's too nice. And well, I mean, I did. I mean, I went in there and I thought, oh man, because Pottery Barn has donated the furniture, you know, for this thing. And I go in there and it's just beautiful. And then one of the donors got me aside and she pointed to this corner where there's a big picture of Paris and a thing of the Hepatitis. And she said, I want you to stop saying it's too nice. She said, why shouldn't we lift the vision of these girls so that they are saying to themselves when they sit in this room, I want to go to Paris. I can go to Paris. So that got my head right. So anyway, but I'd love to have you come. I'd love to have you see it. There's 13 rooms, each very small kitchenettes, no stovetop, but a hardwired microwave, a small fridge. And that's important for the girls that we're going to be dealing with who have been much abused on the street, the majority of them, or in their situations. And are not with their families, so they have a lot of issues. They're going to need to be alone sometimes, and this allows them to have that. At the same time, our philosophy is to draw them into community constantly. So there's a great room, this the former sanctuary in this church, and it has a laundry room. It has a communal kitchen. It has a counseling room. It has a place for kids to play games and, God help us, watch TV. And all kinds of things. So it's where they're constantly drawn in. There's a study center. CBT Nuggets has donated 4 new Apple computers for a study area and a computer lab. So they're constantly drawn into this to be together. I did not put a cook on the staff intentionally because I want these kids to cook for themselves. I have community. The beautiful part of this is the community pouring itself into this. I have so many people that are showing up to help kids do things. I have a portrait painter who's going to paint a picture of every kid and hang it in the entrance before they, and when they come in. I've got the Junior League is giving each girl a cookbook and is coming in twice a month to teach these girls to cook a particular recipe in the book. Southtown Rotary is building, they say they're building it with the girls. I say wait and see. They may watch you build it. But they're building raised bed gardens and a meeting area outside with a roof in the back, in this grassy area out back. And they're going to show up when the produce comes in and teach girls how to cook fresh produce, what to do with it, things you do, how to do stir fries and things like that. So just a lot of example. The village school is going to teach them African drumming right across the street. Just a lot of things where the community is going to pour its love in. 13 kids won't make much of a dent in the number of homeless unaccompanied kids in this community. Of those still enrolled in high school, we know that there's 400 approximately in the 3 school districts. Is that about right?
About right.
About right, yeah. So, we're not going to make a big dent, but this is a model that's being watched by the state. House Speaker Tina Kotek's very interested in this project, as is Colt Gill, the #2 person in the state of education right now, who spoke at our opening. They're all watching this, looking for ways to replicate this model across the state. We're going to replicate it. We're in the process right now of doing the planning for a similar facility for boys that's going to be in the Bethel School District at a site yet to be announced. We hope to build a 3rd in Springfield, Janet. But the next one will be in Bethel. And we hope to begin construction on that this spring and complete work in about 8 months. So, and it'll be similar size, 13 boys, 16 to 18. Again, that won't solve the problem numerically, nor will the next one, but you begin to end the cycle for each of these kids, and in the long term, you start dealing with the problem in a meaningful way. We're not warehousing kids. We're trying to, the program we have planned that has mentors for each kid, we're making counseling, getting the kids all, getting everything that they need, work placement, a lot of different things. We have a scholarship fund that's set up that's going to, interestingly, the scholarship funds, not going to pay for tuition. It's going to pay for residential. So when the kids decide to go to college, because a former principal from South Eugene, whose name's escaping me, with Southtown Rotary, set this up. The idea is, he says every one of these kids, if they can do it, can get it. If they can go to, they're going to get a full ride. They can get into a school. But what they don't have is the money to pay for their housing. So it's a great idea for a scholarship. So I've talked long enough about that. Youth House 2 I've just referred to. Now, the annex is what we're calling it, the addition to First Place. It's in the former Crossfire Church, 4060 West Amazon. We're already housing families from the Dusk to Dawn program that the mission generously, amazingly, for 2.5 years, put up in their modular office building. It's called the Hub, is that right? The Hub, and then we decided to move them out with the blessing of the mission to this new facility. They're in there now, and each family, where they had a cubicle in this because of space limitations at the mission, they now have a separate room. It's a better environment, I think, in terms of just building-wise. But we really appreciate the mission helping us and providing us with the Dusk to Dawn program. Our next plan for the shelter is to bring the preschool in April when Dusk to Dawn ends. We're going to bring our therapeutic, trauma-informed preschool that's currently run in the First Place Center right next to that. We're going to increase our capacity for that preschool. Families will come over with the kids when they come, take classes in parenting, financial management, different things. And then in April of 2019, our goal is to complete the conversion of this massive sanctuary that this church have into 20 apartments that will each have 1 bedroom, and some of them with adjoining doors for large families. And our goal is to keep families in there for short term as they bridge into permanent affordable housing. And how long that stay will be, we're trying to be flexible on. It's getting harder and harder to find that affordable housing because we're not building new stuff as quickly as we need to. But it could be anywhere from 45 days to 6 months, to perhaps even longer. But the goal is to move people out. It's not a permanent place for them to stay. But we think it'll be a good place for them to stay. We're turning that in. It's the latest iteration. We're converting the Interfaith Night Shelter program, which has been around for 27 years. That's going to become, that's now moving to the annex with the former Crossfire Church. So instead of having churches, or faith institutions, excuse me, throughout the area host families for a week, and in the case of saintly First Christians, sometimes 3 weeks at a time, 4 weeks at a time. I'm sorry, amazing.
3.
Yeah. So we will have them come, volunteer, and we're still working out the details to cook meals in a communal kitchen we have there, be with the families, play games with the families. But we think it'll ease the burden on the faith institutions and hopefully draw others into participating in this, as well as not only faith institutions. We've got service clubs, other organizations, even some businesses that are interested in volunteering. So we're trying to expand that pool of people that have daily interfacing with the homeless community and become part of our constituency for the youth, for the homeless board in what we're trying to achieve in the community. So I've talked a lot. There you go. Any questions?
Questions from anybody here?
Yes, Dan. Yes, Dan.
In my business, we say thank you, Jesus, but in this case, I'll say thank you, St. Vinny's. But when I came here in 1991, it was the first year of that program, and I'll never forget being told we're doing this temporarily in churches, just as a temporary stopgap solution. Remember, Susan? Right? And here we are 27 years later. I mean, it just stuns me of how long it takes to do this, and I'm just so thankful. But I'm particularly wondering because I've heard that Station 7 at times is not full because of teens' fear that they know that parents have to be informed of where they are, and so they refuse to come into shelter because they don't want their parents to know. Is that the case? And have you guys figured out the solution to that?
Maybe Janet can,
Kirsten was here earlier, but she wasn't feeling well, so it's too bad that we've missed her. But because of their funding stream, they do have to have parent permission for the kids to stay there. And so there are times that the parents are the ones that are not agreeing.
Right.
And so, with all agencies, you can't make those exceptions when that's where you're getting your funding from. And so they, when they moved to their new location there next to New Roads, their numbers did go down and they were low, but they've been full lately every time that we've talked. So
yeah, we will be notifying DHS of the kids that we have in our system, but we are not taking the kids that the state has guardianship of. We will not be receiving state funding for these kids. We are funding the lodging and the services for these kids. Roughly, DHS was telling me yesterday, there's now about 70,000 homeless children in Oregon. And we are, can anybody hear me?
Yeah, just get closer.
Yeah, and 2,000 are under the guardianship of the state. So we're dealing with the other kids, what we call the invisible kids, which is the original reason why we came along. These are the kids who are slipping past a lot of people. Looking Glass does a great job. I salute Looking Glass if there's anybody here. But there's so many kids out there who are invisible and who don't have money pinned to their coattails. So they don't receive care. So our model has been to try to do this with community support, community funding. We have no debt service to pay on this building because the public gave us $1.87 million to pay for this place. So that's how we're doing it. We're able to do this with community support as long as the community supports it, and that's our plan. And we have county assistance for our operations. Yes.
Well, that was my question. Is I understand that the capital part of this was privately funded, but how are you funding operations?
Operations, as I say, the county is helping us with some funding on operations. Primarily, we're relying on a combination of faith institutions that are buying scholarships or making scholarships, $6,000 each for kids. We have quite a number of those. We also have individuals. We have companies and service clubs that are getting sponsorships of individual kids. And so we are funding a big chunk of this through those scholarships. And also St. Vincent Paul's picking up a portion of the tab. So that's how we're doing this.
What's the level of staffing that you're going to have on site? Is it going to be 24-hour?
We're going to have 20, whenever the kids are there, there will be an adult present. And we will have, yes, 24-hour staffing. We'll have an assistant resident manager, a head resident manager. The assistant will be the resident at the facility. We also have a full-time caseworker that Directions is providing as part of this. Jose is providing the resident managers, and they'll also be backing that staff up with staff from their main office. So, yeah. Yes.
Just a quick comment. So I had an opportunity with 15th Night Catalyst organization to actually go and see the facility. It's absolutely beautiful, and it should be, right? I think you mentioned, Paul, at that time when you did sort of a tour that it was about $1 million a year to maintain the facility. Somehow I heard that, and I was thinking, is that cost of everything, the cost of running the facility and utilities and all that?
No.
Okay, good. Please clarify.
About a fourth of that. Less than,
okay.
A little more than a fourth.
Thank you.
Yeah.
Yeah.
Yeah, I've got to run in just a minute. Yes.
My question was, say a 15-year-old girl shows up, does she get to stay there until graduation? Is there a length of stay?
People don't show up. We have a selection process.
Correct.
But it's not a drop-in center. But people will get to stay 2 years.
2 years.
And our aim is to get them all through graduation.
Great.
And after that, we're going to transition them out. It won't be the day after graduation out with you,
right.
on the street. But we'll be preparing them for the next step, working with them, financial management. Hopefully they have first and last month rent saved. They've got 2 years of rental record under their belts. So that's, you know, in a number of areas. We'll be giving them work experience. So we're trying to we're preparing them in a number of ways. And I've got to run out the door. I've got a 1:30. I'm going to be about 15 minutes late for. So I apologize for being late.
Great. Thank you, Paul. Appreciate it. All right. So what I want to do is I want to thank Rick and Susan and Chris for their committee reports and for the good work that's going on with all of your committees. What I'd like to do now is just very quickly go around our table for items that the executive committee ought to look at in March. And I know, Susan, you had one with a memorandum of understanding you wanted us to begin to look at. So there's one. Anything else, Chris?
I'd like to look at where any housing bills or anything that went through the short session, what's moving forward in 2019, because interim session starts as soon as the committee's in. So it's been legislative action.
Right. Okay.
We have 407 that might come through and might provide some vehicles.
So legislative bills, and then also we've got the memorandum of understanding. I know we'll have some other items as we kind of get into things here over the next few weeks. So if you've got anything, send them to.
In addition to the memorandum, we'll have some other things related to the youth development grant.
The youth development grant is what Steve mentioned. So if you've got anything else you're thinking of, you know, just be sure to email them to Alex and Steve or me, and we'll get them on the agenda and take a look at them. Is there anything else for the good of the order? And if not, I'm going to close the meeting.